Let me know when you're ready to rock and roll.
You are on. And the lights are on.
You got 4 seconds.
Good evening. Welcome to the Lincolnville Select Board meeting, January 8th, 2024, 6 p.m. at the Lincolnville Town Office. Chair Dunn will not be with us tonight, nor will Select Board member Tarantino. Thank you all for coming. First on the agenda, the Citizens Forum. That's for non-agenda items. Anybody who has a non-agenda item that they would just like to talk about with probably little to no engagement with anyone here at this board, please feel free to come to the podium. Not seeing anybody rushing to the podium. We'll move on to the second agenda item, the administrator's report.
Beyond what's on your agenda, we've had some interactions with the folks from FEMA and Maine Emergency Management regarding the December 18th wind and rainstorm. They're still trying to verify statewide they won't have any trouble hitting the goals, but they're looking for total damage in Waldo County, and they're providing them. We provided them an initial estimate as we were supposed to a couple days after the storm, and they're now looking for more detailed information, which we will be providing to them right tomorrow, close the business, because that's what the deadline is. And they're not sure if Waldo County will meet its threshold to be included in the disaster declaration. So, stay tuned.
Perfect.
Working behind the scenes on the upcoming election. For anybody that doesn't know, there will be a presidential primary on Tuesday, March 5th from 8 a.m. to 8 p.m. at Lincolnville Central School. Different new rules this year a lot have been changed. This is going to be an open, semi-open primary, where if you're a registered Republican, you'll get the Republican ballot. If you're a registered Democrat, you'll get the Democratic ballot. If you're registered to vote but unenrolled in a party, you'll be able to get the ballot of your choice, which is adding the nuances and wrinkles to those behind the scenes to track things and report. But particularly when the Secretary of State's office hasn't been able to find a guidance yet, we'll be able to issue ballots in the month. Stay tuned. But just plan on coming to vote at school on Tuesday, March 5th.
Certainly a good time.
Yes.
Any questions, concerns, or anything to add to that before we move on?
Anybody get any concerns regarding snow removal from this last?
No. I haven't. Do you have something?
I just want to say, Father's sons did a superb job on our road. A great thing.
Thank you. I will say this storm was a lot different on Hill Road than the previous storm, which we lost a lot of shoulder, believe me. And there was not a lot, if any, snow on the ground, and to use a wing, it's ridiculous. But anyway, apparently there's been some adjustments, and I did notice a difference in this last storm.
It's frozen.
Yes, very, very helpful. Yeah.
Yep.
Okay, if there's nothing else, that's the administrator's report. Thank you, David. We'll move on to meetings and announcements.
All meetings are here at the town office unless announced otherwise. The Heart and Soul team is scheduled to meet tomorrow, Tuesday, January 9th, noon at the community library. Cemetery trustees, that says Tuesday and early Wednesday. January 10th, 5:30 here at the town office. Planning board is meeting Wednesday at 7 p.m. here at the town office. A meeting that's not on your agenda is the comprehensive plan review committee. The meeting Wednesday, July 10th at 6:30.
July, I'm sorry, July 10th?
Yeah, January 10th.
January 10th.
I was trying to get the time right.
Okay.
Off the cuff. Somewhere here in the town office. So, Conservation Commission is meeting Thursday, January 11th, 4 p.m. The town office will be closed in observance of Martin Luther King Jr. Day on Monday, January 15th. The Select Board and the Comprehensive Plan Review Committee will meet in the workshop session on Wednesday, January 17th, 6:30. And the Select Board meets next in regular session on Monday, January 22nd, 6 p.m.
Okay, thank you very much, David. That concludes the meetings and announcements. Next item on the agenda, upcoming community events. Anybody have any upcoming community events? Okay, nothing on that. Agenda item number 5, meeting minutes of December 26, 2023.
I move the board approve the December 26, 2023 meeting minutes as presented.
Second.
Moved and seconded. Any discussion? No discussion? All those in favor? Motion passes. Next item on the agenda, the Heart and Soul Team update. I believe we have a member of the Heart and Soul Team here for an update.
Thank you. Susan Silverio, project coordinator. And as you know, we had open houses here, workshops every Thursday in December. There are 4 of them. Very much appreciate the select board support on that, to keep a presence here in the office, and it was worthwhile. We had 2 new people volunteer to help with the story listening, and now listening to last count was 96 stories. We've interviewed 96 people, and so now the next step is to look at every one of those transcripts and pick out all the items that indicate someone's what matters most to them, their hopes, their concerns, and their ideas for action. So that is our next task. We need to enter all of the data of those 96 interviews and 182 survey responses that were online survey, and listen to all of those, and then we will tag all of those items with a theme. It doesn't directly relate to the comprehensive plan, but somewhat. There's all different themes: community, culture, history, recreation, all those things. So then, our next step, we are entering phase 2.2 of our 4-phase project, and we're looking at crafting heart and soul statements from what matters most, just that item, the big overarching item of what matters most to people. And we'll have a training for facilitators to learn how to do that on Saturday at the library, 1 to 3. And so our goal is to have 12 people who are trained to facilitate this crafting process. So when we have our big meeting, February 11th, at Sunday, Super Bowl Sunday, hoping to start with a Super Bowl buffet to celebrate the day, and then invite everyone in town to come in and receive in big bags of shredded paper everything that's been said about what matters most to people. We will read every item aloud at each the various tables, and then craft statements that will somehow express what will become a vision for the town of Lincolnville to inform our comprehensive plan. So that's not the end. Those statements then have to be reviewed by all of the town for revisions, for comments and revisions. So it's always an ongoing process of taking it back to the townspeople for review and comment. But our big dates are January 27th, Saturday at the library afternoon, and then February 11th, Sunday, 1 to 3 at the school. We'll have more publicity about that. And then that following Tuesday, we'll come back and figure out how we're going to present this to the town for our 30-day review process. So, given questions, I have to get considered.
Thank you, Susan. Are there any questions for Susan on any of that
No.
as of now?
No.
Thank you very much. Appreciate it.
Thank you.
Thanks, Ed.
Obviously, a lot of work, very, very comprehensive and ongoing, and a lot going on in town. Okay, our next agenda item, we have a member here from Northeast Mobile Health Services for an EMS update.
Good evening, all. My name is John Powers. I am the Division Chief for Lincolnville Health Services here in Rockport. I'll really appreciate you folks being kind of understanding of our scheduling changes as things have progressed. As you may have seen in the news, some of the changes in our system that are coming down the road, potentially coming down the road, we've had to kind of shift a few priorities here and there, and I really appreciate David for helping me out with those changes. So I apologize for this taking so long. I really wanted this to be a few months ago, just to give you folks kind of an update as to where our agency stands and the responses to Lincolnville. Now that we've crossed into 2024, I did want to provide a comprehensive review of 2023. Unfortunately, timing has not worked out well for me, but I will provide you some rough numbers tonight, but I will provide the board data that we've got at the board. A much more detailed report of the activities in Lincolnville. But at least I'm going to do the update of our agency. So we can address some of the other things that have been in the news, answer any questions that you may have. So the Rockport Division continues strong as far as staffing goes. We've actually seen a number of improvements since last year. And when it was last year's presentation, we look at pretty weak a little bit. Staffing continued to go down. I'm convincing myself that during the rebuilding phase, as I took over the new administration, and things are starting to improve. With a number of changes as far as our processes, our onboarding, stuff like that goes, and I think that's really made a lot of changes. So as it stands right now, I am 8 full-time emergency medical technicians, which is the maximum right now in our schedule. We have also 8 per diems that backfill that, so if anyone need time off, any of them are sick, we do have folks that can backfill. For advanced EMTs, I've got 2 full-time and 2 per diem. We don't necessarily have a dedicated spot for advanced EMTs. We tend to put more dedication into the full-time paramedics, but they are filling a number of the open paramedic slots right now. For paramedics, there's been no significant change for our numbers as far as paramedics go. We still have the 5 full-timers, and I have 1 per diem paramedic that's up for the regular shifts, which leaves us still 4 openings for paramedics. Now our future plans, aside from hiring more paramedics, is we do have a number of advanced EMTs for regular. I've got 5 that are currently in the process of completing their classes. So we'll be able to fill a number of those positions with advanced EMTs. Our staffing model in the past has been a paramedic and a lower license level on every truck, either an advanced EMT or an EMT. We're shifting a little bit and looking at providing an advanced EMT on every truck, and then having a paramedic fly car or a paramedic ambulance on staff, so that we can continue to provide the paramedic on the Charlie Delta and Echo and provide the advanced on the Alpha and Bravo calls. Everybody remembers from the emergency medical dispatch, everything that goes into 911 is coded with a priority level. Under the contract, we're required to provide a paramedic on the Charlie Delta and Echo responses. So the number of those recently has been much higher than normal. We can staff with an advanced EMT, and then have a paramedic fly behind them to just to maintain that coverage. And then if they're not needed on that call, they would clear and then be available for the next call that comes in. So it's a little bit of a shift in what we've been doing, but it's certainly an acceptable or a standard practice at Ultimate to have a paramedic in a fly car setup situation where they either first respond or back up a localized system. Some other things that we've done most recently is that to the first of the year, we have gotten a drastic increase in our sergeant pay. We are now very well positioned to be competitive with other agencies in the area. Sometimes it's very difficult to get those types of changes, especially when call volume is down, reimbursement is down, but we've had to retool some things. We need to stay competitive within the job market. In this area especially, we have agencies such as Belfast, Rockland, and Warren, who are offering significant amounts for staff in their stations. We need to maintain that competitive edge so we can attract new applicants and keep the employees that we have. So we did have a significant increase on January 1st. We're now offering sign-on bonuses, shift differentials, assignment incentives, all things that we've done a little bit of, but now we are in full force. We've made a number of changes within our structure to allow us to be able to provide these types of things. So if you know anyone who has an EMS license, we want to look our direction again. While we weren't traditionally one of the higher paying agencies, they may find us a lot more competitive now than we were in the past. Hopefully that will start to bring in, actually I know it's already started to bring in applicants because I've hired 4 new EMTs in the last couple of weeks. We'll start to see a little bit of an upswing finally after the drastic losses during COVID. As I mentioned, some of those changes in our structure, actually, any questions about the staffing? We did make some changes in how we staff in our station as well. Traditionally, we did 2 24-hour trucks as well as a third 12-hour truck 7 days a week. We took a hard look at our data to see where our coverage needs are. We also readjusted, as some folks have seen in the newspaper, North Star is now doing a lot of transfers like Penn Bay Medical Center, as well as Waldo. So our services really weren't needed in the way that we were staffing for, say, Penn Bay or Waldo. So we did take that opportunity to reduce our staffing at night to try and save some of that money and shift it to offset any increases we would need in the future, or to provide these raises. So we're better utilizing our staff, focusing them on the busy times, and putting more emphasis on when the 911 needs are than we are on the transfers. So at night, we do staff 1 truck 24 hours a day, so that covers from 6A to 6B, or 6A to 6A. More often than not is the paramedic level truck, so it'll always be the first truck, I will always be a paramedic. The second truck comes in at 7 a.m. and is on until 11 p.m. It seems to be the busiest time. Today is definitely one of those days where we're available. 83, which the third truck comes in at 9 a.m. It's a 10-hour truck, so it's on until 7 p.m., which again is that busy time. Between noon and 7 p.m. Seems to be the busiest time for not only the commute time, the lunch time. I think the facilities, it must be maybe even the doctors come back from lunch. I don't really know the reason why those times seem to be busy for the facilities, but they are there as well. That covers the bulk of the busiest times within this coverage area, which so far has worked out pretty well. Since we've made that change, we've only had to call mutual aid roughly a dozen times, which for our past history is actually pretty significant, pretty low. We do have a 4th truck available. It is fully stocked, and available to us at all times. It was actually needed today. We actually dumped the entire station all within about 15 minutes. We've got 4 ambulances on the road for 911 calls in this coverage area. And there are those days. Thankfully, I had a partner there, we met on the team, we came through. So we were able to get all 4 trucks on the road today. We covered all the 911 calls. We do also have the supervisor flight car, which was kind of transitioning into the paramedic flight car. That's whenever there's a paramedic available for that. Usually, if the overnight truck or 24-hour truck was only the gas level and will still have a paramedic, they'll just be available on a flight car. Any questions about how some changes in our staffing? One significant changes to our fleet has been we've upgraded the quick response vehicle. We went from the blue Ford lawnmower that I don't think anybody actually fit in to a nice new 2020 Chevy Tahoe. The new unit is completely outfitted for paramedic level equipment, including cardiac monitor, medications, and all of the equipment necessary to provide paramedic level care. Right now, the only thing that isn't on it this time of year is the narcotics. We haven't seen them be carried those types of medications, the risk of it being broken into or like that, so we chose not to, while it's not always in the station. It is also capable of carrying patients short distances, so there is a short haul setup. If you have a patient that is off on a snowy somewhere, the vehicle in theory could go out and transport them back to the ambulance in bad weather or anything like that. We are also using it a little more for instances where maybe an ambulance isn't necessary, so we keep the ambulances available. Carbon dioxide alarms with no patients. Standing by a structural fire with no patients. Those types of calls where traditionally we've sent an ambulance when we've had it, we know we're going to have it, but at least there's an EMS provider on scene to evaluate. And then if they're not needed, they can clear or they provide care until the ambulance is arrived. So a lot of flexibility in that vehicle. I think this one is a great resource for this area. And it will also serve, we're talking a few minutes about our community paramedicine program, it will also serve as our community paramedicine vehicle. So less flash with the ambulance, but it's still small.
Any questions as far as we've been so far?
So some of the initiatives that we plan, the folks that we talked about last year was the community paramedicine program. Community paramedicine is an effort to keep our citizens at home, to really prevent them from needing care elsewhere, from having to go to the emergency room or to go to the lab to have labs drawn if they're not capable. But really bring health care to them, or the follow-up with the reconciliation of medications, safety checks, anything like that. This year we were successful in obtaining a grant through AEMS to establish that program finally. Folks have seen me talk about it, but haven't had any traction. They all came down to finances. It's going to be a very expensive program to get started in the way that we see it getting started. Our goal is really to bring care to the bedside. So if we get to a point, our goal is to get to a point where if we have somebody with a laceration out here on Belfast Road or some other road that is much farther out, then we don't need to go to the emergency room. We call it the paramedic, they come up, suture it up, evaluated by a physician via telemedicine, and that patient can stay at home instead of that cost the emergency department bill or the time taken out of their day or away from their family or anything like that. We may be able to treat this at the bedside and not have and prevent all of those expenses. Follow-up, we're hoping to get a follow-up for patients being post-surgical. Our goal is to, by the end of this year, to have our mobile laboratory certification, so that we can actually go out and draw blood at the patient's bedside and run a complete blood panel on that patient's side, so you can actually give them everything that they may possibly need, identify possible infection. Run to the pharmacy, grab them their script that just got sent in for antibiotics and leave them at home for their urinary tract infection, or something as simple as that. We're hoping to reduce the demand on the emergency room. The worst it goes is to see the news or overrun or understaffed. And our goal is to keep the patients and our citizens at home. So we were successful in obtaining that grant. We've already started the process of getting our mobile laboratory certification. So that'll be our next step. Will be to work with the local medical partners and see how we can best fit this in and be able to start seeing patients here and there.
I have a question on that. Is that additional people? In addition, is that additional people that need to be hired to provide that benefit, so to speak, in addition to the first responders that you already have, or you're expecting the first responders that you already have, or EMTs, or whatever we're calling them, are you expecting them to take it one step further and be licensed to do that as well?
Sort of. It's not necessarily an additional license for them. There is some additional training based on policy procedures and items like that. Ideally, we want to see this grow. It's going to come out of demand. I think right now, having a paramedic be able to go out and do that, it's on shift right now in their downtime, be able to do those types of things. There may be some additional, as I mentioned, suture. Obviously, there's going to be additional training from that type of stuff. It's not something we do today. But we do in Jackman. We practice that skill in our Jackman program. We're already doing a lot of these items in the backwoods of nowhere, which is kind of nice. We are close to a hospital here. We already see the benefits for somebody who doesn't want to transport an hour and 45 minutes to the hospital. So there will be additional certifications, there will be additional training, but it's also something that I'm hoping will attract staff, because it's just different enough for those folks who want to practice medicine, who truly want to be in this practice medicine and practice the skills and have patient contact and take care of their community. Hoping that's going to attract them away from us, attract them to our agency, because it's just that much more different than just sitting at their station waiting for the next 911 call. This is an opportunity to advance your skills, to further yourself, to be able to provide better care. And I think that's going to appeal to a whole demographic of our profession that maybe doesn't want to take the leap to be in facility healthcare, but still wants the flexibility of being out in the street and being able to interact in a very different environment than in a physician's office. You see a very different side of people when you're in their house. At the time of that emergency or at the time of need, there's someone in our profession that's be able to calm that storm. It's a very good thing to be able to practice their skills in that. So, yes, I think down the road we'll see more demand on staff. Short term, I think the staff that we have now will be able to meet that need. It's going to take a little bit of reworking as far as during the day, we would schedule some types of things. Like we were going to do follow-ups, we would schedule. Before Christmas. We'll be able to schedule these so that we have the staff that we need. That if it's during the day and I have 2 paramedics on the ambulance and myself in the office, one of those paramedics can go off and do that while I stand by and cover for them. So I think there's ways that we can make the staffing work and then hopefully attract them.
Thank you. Anybody else have any questions as far as we go?
Well, only that, yeah, John, are you, with the new community paramedic program, are you finding a lack of cell phone service? You mentioned out in Belfast Road. Is that a problem with the program?
We're hoping not. So we have put a lot of technology into the program in Jackman.
Okay.
That we're trialing out right now. So FirstNet, I don't know if you're familiar with FirstNet. It's a subset of it's part of AT&T. It's a federal program that you remember when they took our television away from us, the analog television, and it's go digital.
Yeah.
They took that frequency band and made it a cellular band. It's band 14, and it's dedicated to public safety. It's a stronger band. It travels further distance. It still stinks in this area. But there are some technologies out there that will boost that. So we have Jackman, we actually have a telemedicine box. It's cool. It's a Pelican case. It opens up. It's got 6 antennas inside of it, a GPS, the whole 9 yards. You turn it on, and I'm pretty sure you can taste the cancer starting because there's so much cellular energy right there. But it will draw from 4 cell phone providers, including FirstNet. So if Verizon just happens to be stronger than 5 feet this direction, it's going to use Verizon. So it adds a few. It really strengthens what we can do. Plus, we have each one of our ambulances has a cellular antenna on it, which is a little bit better than our cell phones. We get better gain, we get more power, and then we can use Wi-Fi calling to be able to communicate with the physician or use the video conferencing technology and those types of things. So I think it could be better in this area. I mean, I have no cell phone service from here to Bog Bridge with FirstNet. One of the parts of Hope, this section of Lincolnville, and wasn't terrible into the seasonal, which was odd. But Belfast Road has its spots, but
Yeah, well, that's why I was asking, because I know that, let's say, I wondered how many parts of Lincolnville couldn't be served by that new program because of this volume section, like the cemetery or other places in town.
yeah. I don't think it will be an issue, especially by the time, I'm hoping by the time we get really up and running with this, that we'll have those technologies tested in place up in Jackman. Even in the ambulances, we have this technology for, it's called HPU, it's a high power, but it's another one of those devices that just boosts the gain, takes every piece of, every cellular band it can find, and pieces it together. And pulls it together for the strongest signal possible. So we found some pretty cool technologies. The FirstNet's been a fantastic resource. I mean, those guys really know their system inside and out, and they really want to make sure that it's the best they can be for public safety. So it comes into place. But there's a lot of federal programs for it too. So, yeah. So that. With that, another initiative that we've implemented, folks will remember we were talking about response safety last year. And we've seen some significant changes with not using lights and sirens. Now, part of that now, we're looking at that, hey, look, we stopped responding to a lot of calls with lights and sirens, but we also want you to do a new safety program. So I'm pretty excited with our ambulances because we have Wi-Fi and because we have these connections in another state grant, we were able to start providing our data to help on hazard avoidance and awareness system, a HAAS system. Anybody who uses Waze or Google Maps or Apple Maps, you've seen on there that, accident ahead or speed trap ahead or something like that. Now our ambulances will actually show up as an emergency vehicle approaching. So if we're sitting on the side of Route 1, Route 52, or anywhere here in town with our lights on, it will alert any operators who may not be familiar with the area that they're coming up on something. So it's a really cool program that we've started utilizing. We can track our ambulances anywhere they go, down to the system's incredible. I thought I could track my ambulances before. Oh, not like the system. This thing is incredible. It actually overlays your tax maps or the state GIS data, and you can actually see the house numbers where a unit is. Now it's all password protected, and not everybody has access to that, obviously, and that's for administration, but it's an incredible utilization of a lot of that big data that we see that will hopefully provide a much safer operating environment for us. We're really hoping that that's going to expand to everybody in the state. I think today now, I think we're going to participate in our area. But the state provided new modems, they provided cellular programs for 2 years. So they're paying our cell phone bills, they're paying for the programs, the 2 programs that we're connected to, all in the state grants. So it was all for highway safety. Fantastic opportunity for other folks. They need to open it up to all agencies with an EMS license. They hope that once we prove that this is going to be a great safety feature, keep our staff safe, and others will sign on to it. hopefully so. So those are all the great things that are happening. Some of the challenges that we're running into has been the loss of our 911 center in Knoxtown. I will say that has been a little bit of a burden that we were not anticipating. We kind of thought that this was going to kind of sail through. This was going to be an easy transition. The technology and having worked in the 911 center, that it didn't matter where the call was answered. It made a big difference. I love the folks at both comm centers. It has created a lot of challenges for responders as far as getting detailed information, accurate information, and then appropriate response information. I don't have the numbers right here in front of me, but we have seen a significant increase in our Charlie Delta responses to things that traditionally would have been an alpha level response at best, particularly for our facilities. So we are trying to mitigate some of that and work through a lot of it, getting some of the folks to understand locally where our facilities are, and that they should be used and coded as a facility. That's a little bit of a challenge. So we're getting dispatched to Sheriff Falls at Winter Gardens instead of it being an inter-facility evaluation or transport. We're getting called as if it's an actual full 911 call. So a lot of our numbers are being skewed. We're sending a lot of resources to calls that ultimately probably didn't need it. And the system was working really great until that all happened. Now it's still working, don't get me wrong. It's still working as best it can. Knox is giving us the information as quickly as they possibly can. But we are struggling with some of the emergency medical dispatch pieces and getting accurate information. Things that I didn't anticipate ever experiencing. I thought that no matter where you are, EMD is EMD is EMD. There are different ways of doing it locally. Having worked in both centers, I know that they do the best that they can. And I know human error plays a factor in this. And I know that we're always training the freshman class when it comes to public safety right now. So we are working through it. It has been a little bit of a challenge. We have, so with our numbers for the next quarter presentation, at the end of this year, you will see a little bit of disparity in how the paramedics responded to Charlie Delta calls. Because our paramedic was already tied up on one call, this call came in as a paramedic on call, we didn't have paramedics anymore. Turns out, actually had a paramedic call. There was a call where I would say, and every day was that with a paramedic.
So it seems like it's a huge problem, the way you describe it. And where do you think the disconnect, or where do you think the fall in communication is? I mean, it's Waldo County Communications, and if they're not talking the way Knox County Communications did, they're talking to Knox County to get you dispatched. That's how I understand it. So who's the person or persons or the committee or whoever that's saying, no, wait a minute, this isn't working, we need to do this, or is there?
I've reached out to every contact I have.
Yep.
And tried to get something. And I think what we've identified.
I mean, we're obviously not going to solve that right here.
Right. What I've identified is that the protocol, I think what I believe is happening, I haven't talked to the communication center directly, and providing, I think part of it is we need to provide them better instructions when utilizing protocol 37. 37 is the interfacility and medical transport from Lincolnville Gardens or Corby Hill. Somewhere where there's been a nurse or a doctor who's evaluated the patient already. In the protocol they're currently using 37, there's a question where it asks, what level of response do you want? Every other protocol will do it based off of symptoms. So if they're having shortness of breath, if they're having uncontrolled bleeding, if they're having chest pain, all those symptoms kind of get clicked through the protocols. But the nursing protocol doesn't. It actually comes up and says, what level do you want? Then the folks who show up are Charlie Delta. And I think folks are just clicking OK past it. And that gets sent, not discussed, but sent to Knox as 37 Delta,
Yeah,
whatever.
okay,
And
right.
now, there are some changes that I know the state is making. We've actually, the Indy vendor has released a new protocol set in the 40s that are better designed for facility transfers, for behavioral health incidents, and for emergency helicopter suites. Very specific protocols. And that vendor has released those recently. Or at least Maine has taken interest in them recently, I should say. I think we've been out for a little while. I think just because of the changes that we're seeing in our 911 system statewide, and the state is now taking a little interest in those. State is the one that provides those systems. County provide, and municipalities provide. The state provides that. So I think they're starting to take an interest in it. A lot of PSAPs are starting to see that. Are starting to see these changes. And in those protocols, you can provide a much better, more detailed functionality. So if you have somebody who fell 4 days ago and just isn't getting any better, they'll call unless they have priority symptoms.
Yeah.
You know? So I think we're going to see some change. This is just really putting it out there that this has been a challenge for us. Something we did not anticipate, thinking that, oh, easy indeed, it's not a big deal, we'll get through this. Everything else has been fantastic. I mean, the rate at which we're getting our calls, I think the rate that the citizens are having their calls answered, all those things are still in place. I don't think there's any change on that end user. For us, that's the really the only change we see. We're just struggling with that. Well, this is the next thing we're struggling with is local knowledge. There is something to be said for local knowledge. And some, even if it gets transferred to Knox, Knox will inject some of that local knowledge, so we haven't seen a huge loss of that. But as I said, like utilizing Protocol 37, they don't recognize that 105 Mechanic Street is Wynwood Gardens, and whoever's on the other end of that phone didn't say, oh, hey, this is Wynwood Gardens, then the dispatcher wouldn't necessarily know. You know, that we've been in Knox for a period of time,
Yeah. Okay, there's a few steps that need to be taken to a different level. Understood. Okay.
When did this change occur?
Oh, the 911, so they lost the 911 last fall. And it was
I don't remember what it was.
August or September is when they made the transition. They have things are in place, their staffing is improving. So they've gone on 2 more in the last week, but I know of their previous dispatchers that are going to be hopefully very quick to get back to the desk. They did work for their certifications and stuff like that, get them back, but I think they're well on the path to get their PSAP status back. And it sounds like the state is amenable to that, so I'm hoping we're going to see that sooner or later. The only nervousness that sits in the back of my mind is, well, the two used to be back up for each other. And now we're relying on this, but they don't have backup now. So, if something happens in one of the communications, I know they have plans in place, to work with the other PSAPs, state police, and stuff like that. So I'm not fearful of it, but.
No, it's not a direct path. Yeah. Okay.
But there are states, New Hampshire operates with a 2 PSAP model. Just the 2 PSAPs. They both operate by the state. All they do is answer 911 calls. And they transfer to other dispatch centers like Knox and set up now. And it was talked about years ago. I don't know if that's still the end goal of the Emergency Services Communications Bureau. I think I'm trying to interpret the state intentions there, but they've always been talked about it. Regionalization as we move forward is going to be the most economic way. It's just going to come down to what we really give up. We're not even necessarily giving it up. Sometimes it's just a different way of getting the same goal. One other challenge that we've been experiencing, as always, is revenue. We're hoping to also see some improvement there. The last legislature approved the increases in the Medicare reimbursement, so we're going to see some significant changes there. We've also seen the approved, main legislation is also approved or mandated that private insurers pay for no transports. So that's going to be big for us, particularly in this area. We have a lot of no transport responses. The national average is about 28% of your call volume. Ours is closer to 30 to 32. No transports being anytime you go to a patient or treat them in their house, and they basically the goal of including the medicine program. But we're hoping we can start seeing reimbursement for those sorts of things. So that's also going to have an impact on how we ask for subsidies in the near future. Is that we take that into account before we just write them off. These are calls that we just don't collect anything on. Now we have anticipated revenue for these.
Yes, so when will that kick in?
It was effective January 1st.
Okay.
Yeah, whether the payers are ready for
Yeah,
that
right,
change,
yeah, okay.
we may not see any revenue until probably in September.
Well, you can start sending them the bill.
We can start sending the bill, exactly. And, thankfully it hasn't required us to start collecting insurance information from somebody we lift up off the ground and put them back in the chair. But, we'll do whatever we can to try and collect that, to try and ease the system. Shy of obviously sending them the collections for a small amount. Yes. A lot of these calls, we're talking not a whole lot of revenue, but it'll at least cover the responsibility. So, any questions on those updates? Today, roughly, our call volume last year was up about 115%. Moving from 1,700 911 calls to just over 2,100 last year. We saw a lot of 911 calls last year. Concerning, and then it's growing at that rate of speed for 911. Our transfer volume was down a little bit, certainly helped. So we rely on the revenue from the 911 calls to offset the other expenses. But we're hoping that, hoping that if it continues on that track, then the resources in this area is going to be much more important to make sure that we maintain this factory, maintain the number of trucks that we have, and the availability of these goods. I think this is going to be that much more important. Oddly, maybe we'll see a 4% decrease in the number of calls from last year. So 2022 and 2023 is about 4% decrease. So thankfully, your citizens are much happier than that said, I will get a full comprehensive breakdown of all the call lines, all the call types, and everything for town that will be folks in the near future. But I really just want to give you some updates on the system. So obviously the next big thing to kind of discuss is where is our system going? And I really wish I had some answers for you. I really wish I had some answers for you. There's been a lot of speculation about our coverage and whether or not we're going to be here. And I'll assure you that as long as we are needed in one of these communities, that we will continue to have a presence in these communities. There's no intention for us to pull out. We had no intention of closing up shop last Thursday, the Tuesday before that, or 16 years ago when we started. Still here. But everybody's been, other members of this contract have been making plans as if they're closing it down. That may have an impact down the road. We don't know exactly what that impact is yet because we don't know really which direction this is all going. We will certainly support the communities and whatever they choose to do in the future and do whatever we can. All we can do so far is really encourage the communities to stick together. A regionalized approach like everything else is going to be the most economic option for the citizens. To piece this out and think about it, provide it on their own, is going to be fairly expensive on the end user. Because it's more expensive. We went to regionalized communication centers for that reason. We started regionalizing ambulance services. It's just going to continue. The entire nation is going to regionalize everything. And it's the best option for us as far as revenue goes. Because now you've got group fund things. The more people that pay into it, the better services you get. I'm telling you anything you don't already know, but we just don't know what the future holds right now. There's certainly been plenty of meetings, and if you haven't had an opportunity to view any of the meetings with our board of planning, I would recommend it. It was tremendous, you get the facts for yourself, because there are a lot of things that have been discussed, a lot of plans that are in the works. And a lot of that was under speculation that we were either going to go away or we were going to start charging $6 million for our services. Thankfully, after crunching and tightening the belt, taking a look at our operations. So Rick Peters, our new CEO, has taken a lot of look at our operations over the last 3 years. The entire management team has taken a look to see where can we improve, where can we cut some of that, where can we really focus our energy to streamline our operations. And we've done some. We moved our base from Scarborough to Saco, which only just flew the rumor mill that we were going away that much more. We left $1.5 million building that was costing us $2 million. We didn't need the space anymore. We've downsized a lot of our programs, and so we didn't need the space. So we just downsized our operations from that location and combined Biddeford and Scarborough into one location that is better centrally located, instead of having all of that overhead. So we moved it closer to our operations in Sanford, which is where a lot of our contracts in the Southern Division are. We operate primarily at the Goodall, Southern Healthcare, Sanford location. And so we moved our trucks a little bit further south. Made more sense, saving more fuel, saving more wear and tear, and we get supplies to them a whole lot easier. But not paying those for Biddeford and Scarborough bases, we can save a lot of money there. As I said, we modified a lot of our staffing levels, but we're really focusing on when we're needed. So instead of having staff sitting at base doing absolutely nothing overnight and waiting for a transfer, traditionally transfers don't happen a lot at night. So we stopped staffing the Brunswick base and put Saco overnight. Huge savings as far as staffing costs go. Because they just weren't being utilized, and the expense just wasn't paying off. Then we reduced some of our other corporate some of the vehicles that weren't being used in our paratransit division. Some of the extra pickup trucks that we had kind of around for events and stuff like that. So we lost a lot of those expenses. But what we hadn't really cracked yet was the impact of North Star. When North Star came in, it was pretty good. It was been staggered impact as they staffed up and saw what they were going to be doing for transfers. Doesn't mean that we're done doing transfers. We are still doing transfers. What was one of the perks of this model was that we subsidized our presence here with the transfers as well as the subsidies from the municipalities. So we are still doing transfers. Some folks were really concerned that we were done with transfers. And that revenue stream is gone now. That doesn't mean that we weren't anticipating that. And we are. I'm going to use approximately about $700,000 in anticipated revenue. Pretty significant. So, as I said, a lot of those changes, though, that we made have softened that. So, with that change, we are still doing transfers. There's a lot of demand, we have a new partnership with North Star to help provide the level of care that they're looking to provide to their customers by utilizing us. Same way we used to when we were primary, we could always start in those areas and they would help transport patients then too. The partnership is just that stronger, in my opinion. I think our communication between the two agencies is just as strong. They have their missions, we have our missions. And it's working out pretty well so far. Now, with the 2023-2024 budget year, we had a meeting with the town administrators. Did you send them a email or? Yeah. You already have it. That's what you've been doing going on.
That's right.
So, as you have in front of you, you can see everything I'm basically telling you, but what we're anticipating for an increase is as low as we could possibly get into the changes that we've made so far. And to continue to maintain the level of service that we're providing. So there was a little bit of a hike, very significant hike, but Lincolnville. I'm not going to sugarcoat that. It was not the number I was hoping for, but it's a lot better than I was really afraid it was going to be. We really spent a lot of time crunching these numbers, and we think this is really where we don't want to be. It's not. I don't want to be. I would really hope for something more this year. But I think in the interest of not putting that burden on the citizens, then keep it as level. And that's one of the perks that we have is that we just keep training until we get to this. Other agencies meeting up with that. We want to work with you. We want to work with the communities. We want to stay in these communities. So we're going to be competitive and then provide everything we can for that price.
So, as you get into that conversation, I get why you say we're not going anywhere as long as the 4 communities are, joined and our services are needed. I get that. I get that this is a substantial increase, not quite an increase, it's a substantial increase to me. There's also information out there which you mentioned. You ought to listen to the Camden and Rockport meetings because, they're making plans. Well, yeah, they are. But we, on paper, I suppose, should have a voice in the, but we don't. We find out about it on social media or in local media. It's almost like we're, you better follow suit or you're out. That type of thing is very, very disturbing. Also, this respond but no transport. Camden is now permitted to respond, and Hope is under them. He goes in the cold, it is out dark, then it goes out. So we're not involved. We're not involved with it. And I shouldn't say that we're out, that's the wrong terminology. But Rockport is moving forward. They are moving forward. They are. They're moving forward. And regardless of what anybody says about Camden, they're going to do what they want whenever they want to do it. It's just the way it is. And if we don't follow suit and pay big money, whether we pay this huge increase here, it's only going to get us coverage until these other towns are out, and then we're not going to be able to afford you anyway, and you aren't going to be able to afford to be in the area. I hate to say stuff like that, but that's what's going to happen. Okay? The writing was on the wall probably 3 years ago that one town was going to go behind another town's back or whatever, maybe even earlier than that. So this is concerning, yes. But what's more concerning is from media reports, the towns of Rockport and Camden are currently exploring creating their own municipal ambulance services, which is all in the works. So, this is good, and we get this information every year, and it's good to hear what you're doing and everything. I'm looking 2 years down the road as to what are we going to do without Northeast. You know what I mean? I'm not giving you a hard time about what you've done for us, the way the way everything has worked. You've met your numbers, yes. But now I'm really concerned. And I think I got a really good reason to be.
Absolutely, and absolutely everybody should be. When you're looking at the proposals, as it says in that article, Rockport was looking at and proposing $1 million ambulance service, and then we could have 4 ambulances for $252,000.
Yeah.
I can't explain that level of math to you, but whatever the communities decide is best for them, it's up to their communities. I mean, that's the beauty of our nation, right? So, I I wish I had that outlook.
And I'm not asking
And
you.
that's what we fought for the last, this inconsistency and the instability of our system has been pointed at us and Northeast, but it really isn't. It's the constant rumbles of we're going to have an ambulance service, we're going to have an ambulance service, no matter where it comes from. I'm not saying it's either Rockport or Canyon, but somebody is always saying that we're going to have an ambulance service, and Northeast is out. That creates an instability. People don't apply, so under staff. It's hard for us to provide services, and I can't plan. I had a member of the Canyon budget committee me last year. Like, what's your 5-year plan? I can't plan past the next 6 months. I mean, until they signed that 3-year agreement. That was the longest we had. We were living year to year.
Yeah.
And that we can't plan. I mean, I can't put, nobody would want to put, who wants to build a $1.6 million base in a town where you'd be gone in 8 months, because now all 4 towns decided they want something different. It's a very difficult world to plan and prepare for when you're operating in that level. And, you know, there are a lot of changes. A lot of changes over the last few years. I really think over the last 3 or 4 investment we've seen in this area, it really stabilized a lot until just recently. And now we don't know what timeline looks like. Rockport wants to stand up by July 1st of this year. Maybe has had rough conversations about the next year. There's still a lot of obstacles. Both of them have a lot of obstacles. It's not my place to say right now where my opinion as to where they stand, but I hope the citizens everything works out, one way or another. We still encourage regionalization. I know the town of Rockport has an EMS, doing an EMS workshop, in town, discuss their options. You know what's going to go. Again, some of these things are also speculated based on assumptions and numbers. We didn't know all these numbers. This is not, we didn't come in the first year and say, hey, they want 355,000, we're going to do it for 30,000. That's not what these are. These are factual. This is the best I can do. And still provide staff some perks that we need to advance our system, to continue moving forward instead of laying stagnant. There may be some room for negotiation. I don't know. That's above my pay grade. I provided what I thought was going to be the absolute to be able to continue operations and move forward. But
Can you get us, and maybe, I don't think it's been in the stats before, but how often 1, 2, or 3 ambulances are out on a non-transport, so on a 911 call? That would be a really good statistic for us to have as we're progressing in the next few weeks, months here.
A really rough technology week. Yes, I will do that. I will tell you that it was during those busy hours, and even recently it seemed anecdotally that much higher. I mean, we really bumped all 4 ambulances almost half a dozen times in the last month. Before Christmas.
So the example today you gave, you had all 4 ambulances, those were not non-transport, all 911s in one of the 4 communities.
And I mean, it may be beneficial to have one there is transferred, because again, that's still subsidized, or that funds your system. So knowing that, yes, we had 2 ambulances in the coverage area, the 3rd one was somewhere. I can break it down both, so I can show what just 911 simultaneous calls in this area. Some things that do skew that data a little bit is we respond multiple ambulances and motor vehicle accidents. If we don't know the number of injured patients, we usually send 2 ambulances. If not, then we send the ambulance and the fly car. So that way, if there is a patient that needs to be transported, the fly car can always handle folks who don't want to go to the hospital, and take paperwork and assessments and that kind of stuff while the patient gets transported that much faster. But it skews a little bit, but not terrible. It skews a more awkward than this one here. Not the bulk of their calls or their accidents. But yes, I will actually say. You're looking at the Canada has one ambulance and a whole lot of ambulance. We've had talks with Canada about still maintaining the level of coverage and the call sharing style of conversation, and those are very early ones. And we couldn't mention at this point, but we're still communicating. There's still conversations. There's still we're still here to work with the communities and provide whatever care we can and offer. Providing use of paramedic flight car. They're not able to staff paramedic ambulance and paramedic car. We do that for Jackson, we do that in different areas. Kind of an a la carte service. We can all work for everybody. We're doing what we can.
How small is your operation in Jackson? And one or two?
One flight car.
One fly car, one ambulance?
And then we have ambulance. Jackson has 2 ambulances that they staff at the BAS level, so they're only at the EM2 level. And then our paramedic provides that ambulance level. And then they also provide care after hours when the clinic closes. They provide care inside the clinic.
But no ambulance. Very interesting.
Jackson provides the ambulance, so we work hand in hand. And
Yep.
So if Jackson gets dispatched to a call that sounds like he needs a paramedic, Charlie Delta Echo.
Okay.
Paramedic on the back and goes with it. So they just take the fly car. If they're not needed, they clean it. If they are needed, they leave the truck right there and they disappear for 2.5 hours.
Sure. Okay.
We're running for 30 minutes an hour and 45 minutes an hour.
Mike, you got anything?
Yeah, John. Yeah, these may be naive questions, okay? But it's what jumps out at me.
Yeah.
Okay, why would you guys stick around if Camden and Rockport go out on their own? It's kind of a direct question, asking you to speculate a bit, but it seems to be the elephant in the room, right?
We were here before we were doing 911. We were here before we were doing 911. We did pick up, there's still a fair amount of demand up on the hospitals. Also, the demand going away. Also, I may staff up and provide more services, which may impact it. We do also still hold a contract until it's going to hospital, and the VA hospital and the rest of it. So right now, we're the closest base that staffs to Togus. So if there was reasons, we'll do those. We're hoping. The county is also looking at Knox County anyways, all the county's efforts, but Knox County at least has also been looking at regionalizing their ambulance services with municipalities like we're not. So, there's always those potentials down the road, and that's another reason why I personally would caution, entities that are looking to get into the ambulance service on their own, is that there have been so many efforts to just saying, no, we're regionalized. This is the way the county's going. And now here you are with all these assets and resources that they're hoping to stay, but they can just begin we're going to put them in one now.
The second question I got is, let's say Camden Rockport legal. What would happen to these numbers right here? Let's say for Lincolnville, would still be a $88,000 increase, or I mean, you don't have Camden Rockport serving. We may still have some relationships with them. So would Lincolnville be looking at to absorb some of that increase?
We have to look at, I guess it would come out of what level of service you want.
Okay. Let's just assume it's an existing level of service.
Those ones will have to go up. In order for us to guarantee that level of care. So like right now, basically we say this truck is unavailable for transfers. There will be one truck in this coverage area at all times. If it's a busy day, I may say that today I refuse to send 2 ambulances on the coverage area because it's a busy day. When the third transfer team in, Yeah, we'll do that transfer. We'll send the one truck on that transfer and kept 2 trucks. The subsidy doesn't necessarily pay for 2 ambulances. It's one in some. So it gives us that wiggle room and that control to kind of play it by ear. But if we're going to guarantee services, that's what a guarantee is. They will.
Makes sense. Yeah.
Makes sense.
Okay, thanks.
Yeah, and if it comes out of the board, where you depends on other municipalities want a regionalized model, there's always that potential as well.
David, do you have anything? Don't dare say, don't want
I do not.
to. What's that? Okay. Well, as tough as
As
it
best
may
as we
be,
can.
it's understandable.
Yeah. I mean, well, we don't know. I mean, the boards haven't made a final decision. They've put some support behind it, but they don't. I don't know if the true number crunching has taken place. And the census haven't weighed in yet either. So there's still a lot of uncertainties. I mean, we go either direction. I mean, how many times have we gone into the polls expecting something to pass like that, and next thing you know, the citizens say, "Nah."
Yeah.
It could be something,
Yeah.
something as simple as how low something is. What a concern. So you never know. This is just kind of the stress that we're living in.
Sure.
But we'll certainly keep you up to date with anything that comes out. Our goal is to be as transparent as possible. I know in the past we haven't been as transparent as we could have been, and I think that's hurt us significantly in the past. But we want to make sure that our lines of communication are open. I'm always available. After this, or once I get you your more comprehensive report. If you have any questions, please feel free to email me, reach out. I am your email starting my contract, so we'll pass it through me, that's fine too, or if you want to come to me direct, I have no problem with that. Please, anytime, reach out.
Thank you, John, very much. I think I can speak for everybody. We really appreciate the in-depth conversation about what was going on, what you've identified, and what you've done to step it forward and obviously try to help the towns. I mean, it doesn't sound right with what you're looking to change it to, but it's understandable. So thank you very much.
I appreciate it.
Appreciate
Thank you
it.
for your support, and
Yep.
we look forward to seeing you this year.
Thanks a lot.
Thank you.
Good evening.
You too.
With that being said, we have agenda item number 8, land use committee matters, draft charge and facilitator. David, do you want to take a little bit of that? Take a little time to?
Sure. Just give you a brief.
Yes.
I'll try not to take up very much time, John. You're welcome.
Thank you, John.
So I think everybody will recall that back in December, we had a well-attended town meeting that passed the moratorium ordinance, and the select board has appointed a land use committee. The land use committee is scheduled to meet later in the month, and it would be good for them to know exactly what they're doing versus just being given a blank slate. So prepared a draft charge to the land use committee, primarily task was stealing things out of the moratorium ordinance itself for the ultimate of what needs to be brought back to the select board, which is the amendments to the land use ordinance. We had some suggestions as to things they ought to consider doing in their work to familiarize themselves with the situation here and elsewhere, what goes on, can go on, shouldn't go on. And also made the suggestion for the group to have a facilitator to assist them in their work. In the past, at times, we've had consultants, we've had town attorney assist after doing some conversing with the town attorney, we came to the opinion it might be better to have somebody that might be better in terms of cost, and also be better in terms of end product to have to facilitate or assist them. And might be the most efficient and effective manner to get that done. We do have a deadline, 180 days from the applicable date of the moratorium. Reality is, even if we work about as hard as we could to get it in 180 days, we're too hard pressed. So looking to the possibility if we're making reasonable progress, that the select board, after holding a hearing, determining that reasonable progress is being made, that it may be need to be extended. So I could probably talk all night on that, but
No,
oxygen's not coming out the room.
thank you. Mike or Steve, do you have any comments, questions, concerns?
I have a couple. Yeah, go ahead. Sometimes when we put forth a charge for a committee, it has a end date for that committee to exist.
Yep.
Yeah, I believe, is the land use committee also one that's in our charter to begin
Yeah, the
with?
land use committee is, excuse me, established by charter.
Right.
The members have the 5, regular members have alternate, staggered term, and then there are 2 alternates that have the annual term. So the committee will exist after the work is completed, but they won't necessarily have a charge until you give them.
Yep. Yeah. That makes good sense. I have no concerns with the charge as written.
I don't-
Mike,
No,
are
no.
you all set?
I'm all set. I've got a question about the request for qualifications.
I do
But
too.
that's
We'll
down
get
the
to
road.
that, yeah.
No, that's the next thing in the queue, I guess. No, I don't have a problem with you.
Okay.
The draft.
So,
Before you,
David, do you have any?
the only thing I would say is before you, not knowing what the concerns are with the request, the charge does talk about the use of the facilitator, so if you're thinking that you may not to go that road, you may not want to approve the charge until you decide which, they're in the
Yeah, okay. So my question about so it was a civil monetary amount. This is basically analogous to an RFP, one out for a bid. Okay, so is the board or the town on any restrictions cost-wise that we have to?
Well, we don't have a bottomless pit of money.
Right, and we don't, and so there's not a budget line for this.
Correct.
So there's not an existing pot of money for this facility.
Well,
That's what I'm asking.
the facilitation services, depending on who provided them, the thought was that it would become legal, since it was a legal matter.
Okay.
Precipitated this,
Okay.
and the town attorney was of the opinion that it would be more cost effective to not use their legal services to facilitate meetings.
Yep.
That was the thought.
My question is more around, it basically sounded like the chair of the land use committee would have no responsibility the way I read the request.
The request leans a lot on the facilitator.
Yes.
Not that the chair wouldn't necessarily have responsibilities. As I think we all experienced by 200 plus people in the room, sometimes to ask a volunteer chair to take the heat for 200 angry citizens.
Yeah.
Can be a lot to ask versus if you're paying somebody, well, you're getting paid to take the heat. The committee is, ultimately the select board is in charge of both groups, both the facilitator and the committee. it would be more of a partnership, but relieving some of the burdens of the committee. But if we can, this is your request, and if you wish to change tone or words or task, that's certainly doable. I would also anticipate that we as a town will learn more from the proposers when they respond to the request than Dave Kinney and Sally Daggett working to create the request, because these people work with this hopefully on a daily basis, their livelihoods, and familiarity with what goes on elsewhere. So that they come back and say, well, you asked for this, but you really ought to have that. And we say, oh, we hadn't given that thought. You're right. We can change the scope.
Okay, so we have a few things that we need to take care of. If there's nothing else, Mike, are you all set?
I'm all set, yeah.
Steve, you're good? Okay, so the first thing is we need the charge. We need a motion on the charge.
I move the select board approve and sign the land use committee charge following enactment of the moratorium ordinance.
Second.
Moved and seconded. Any other discussion on that particular part of this? None? Okay, go vote. All those in favor? Motion passed. The next motion I'm looking for, request for qualifications for committee facilitation consulting services.
I move to authorize the issuance of a request for qualifications for committee facilitation consulting services.
Second that.
Okay, moved and seconded. Is there any other discussion on that? Mike, no questions?
Nope.
Steve, you good? Okay, no questions. Go to vote. All those in favor? Motion passes. The next motion we're looking for is two-part. We're going to need a delegate from the select board to work with the town administrator to review any facilitation services, the proposals, to bring it back to the board. So if I could have a motion on that.
I'd be happy to be that
You
delegate.
Are you good with, you good with
I'm
that?
good with Steve because he's had your experience with this. You've done this
Yeah.
before.
Chair Dunn also
You guys
volunteered.
have worked for.
She didn't say if nobody else, she said if there's a.
Well, it says or two.
Well, we'll vote her right in then. She's not here.
I'm happy to do it myself, I'm happy to have help, I'm happy to have 5 of you, but 5 of you,
Yeah.
that cat is challenging.
Okay, so how many do you want? How many do we need, David? One or two? Or?
Whatever the board
Let's put two in.
desires.
Put two in.
If both of us can't be there, if only one of us
Okay.
can be there. that
Okay, so we'll look to get two.
So are we going to nominate Lately here?
Lately.
You ready? Well, then I'm ready for it.
Lately and him.
Yeah.
Okay,
Okay.
go ahead.
So I move that the board delegate Steve Hand and Lately Dunn to work with the town administrator to review any facilitation services proposals received, conduct interviews, negotiate a contract, and to make a recommendation for contracting to the full board.
I'll second that.
Moved and seconded. Is there any other discussion on any of this? We're all set? Okay, we'll move to vote. All those in favor? The motion for two select board members, Chair Dunn and Steve Hand, and the rest of that passes. If that's all you need on that, David, we'll move to item number 9.
That's all I need for that for tonight.
Okay.
Item 9 was the authority to post roads. When we put that on the draft agenda, it was turning into mud season. Mud season's now fortunately frozen, but it appears by the forecast short range, maybe bring back on us on Wednesday and then on the
Thank you,
weekend.
Susan.
And we were to the point prior to this freeze up where it was getting to the point where some of our gravel roads were starting to mud and rut, and we wouldn't wanted to have somebody having a logging operation coming out, so
We've got more rain coming.
I know.
So
I reckon-
personally, I think we should go through with it.
Is this something that's, we do this every year?
Yeah, we have, Lincolnville has a weight restriction ordinance
Mhm.
that delegates the authority to the 5 of you. And to get the 5 of you together, or a majority, when all of a sudden the roads go from firm to less than firm, can prove problematic. So in the past, just
Okay.
but
So
it's certainly, you know, if staff went haywire, it's certainly something that the board could call a meeting and call us up on the docket and bring it back in.
One of the reasons I was asking is we only have to do this like once a year.
Yes, correct.
That's all.
Yeah.
in the past, haven't we had dates in there though? Or no?
No.
We haven't,
No,
okay.
we've had dates on the winter road closing for
Okay, that, all right,
Mark,
Yeah. Martin Corner Road.
Mark,
Yeah, okay.
Mark Corner Road, but not for.
Okay, I'll entertain a motion on that.
I move the Board of Selectmen, move that the Select Board, Lincolnville Select Board, authorize the road commissioner and or the public facilities director to post the roads for weight limits as either deems to be in the best interest of the town, to remove said posting when the roads can once again properly support the roads.
Second.
Moved and seconded. Any other discussion on that? Melissa, you got anything on that? No? Okay.
We're all good.
We'll move it to a vote then. All those in favor? Motion passes. Okay, item number 10 on our agenda, the select person updates. Mike, have you got any update on anything?
Yeah, a couple, I guess. One is in the packet in H there. You might want to take a look at the legislative bulletin, and because it could, not legislation, the result of a study or something that they did at Augusta, which could affect the town down the road, because it's talking about kind of the reorganization of the state planning office, or something resembling that may come at us in a few years. And so I thought that was of interest, so I threw it in there, asked Dave to throw it in there. And secondly, I attended the monthly meeting, the MCOG monthly meeting this week, or zoomed in, and it was an interesting discussion about grant opportunities, which I don't know what Dave talked about, because I saw him on the Zoom meeting too, and I know he was scribbling notes while eating dinner. So maybe he could explain what it was. It was a stream watch culvert repair grant opportunities that are available in towns, should towns want to take advantage of it. And I know you got started the process, the application process.
Similarly to what the town obtained for the big culvert on Slab City and what we just did on Townhouse Road, those were partially funded by state grants that we applied for through the stream crossing program, which had been managed by the Maine Department of Environmental Protection. That has switched from DEP to the Department of Transportation, who's now managing that program. The next round of grant applications is due on the 19th. MCOG put on a workshop that I attended, as did Mike and Morgan, to give some guidance as to the new application process, because it's changed. Of course, it's changed.
Yeah, of course.
We have a different entity overseeing that same state, different entity. But it was a good program. Matt and I are, or public facilities director, Dean and I are looking at candidate sites based on the criteria given. Primary ranking is based on habitat and fish passage. I think it's at 50%.
Yeah, 50% of that, 25 to 25.
So on the stream viewer, not to get into too many weeds here, but on the stream viewer, it actually has the stream crossings identified, color coded with green, yellow, and red. And I think green are good. Yellow is not quite so good, and red is
No fish.
not desirable. So it's one of these, can we match up a location that's not good and get a lot of points, but is also not good in terms of capacity, or it's rotting out or something, so we can do double, get more points towards program. So we're exploring that to try to see how this grant program matches up with our road program versus chasing a grant, even though it isn't something we necessarily need. So we will, in all likelihood, be putting in some sort of grant application prior to the deadline, and then if we're fortunate enough to receive another grant, if we could count up the project, that will come back to you folks to meet the grant conditions and so that.
That's it.
Steve? I got nothing as well. Okay, we'll move along to the next agenda item. The treasurer and payroll warrants, approve and sign.
So I move that the board approve and sign the treasurer's and payroll warrants.
Second.
Moved and seconded. Any discussion? Okay, nothing? All those in favor? Motion passed. Okay. Is there any other business that we haven't discussed that you absolutely must say?
I had a couple items. Any update on the note in the extra items regarding the Department of Labor?
The chief and I are going to, I don't know what to put in there, but the chief and I are going to meet with, for an informal conference on Thursday afternoon, because he thought he provided adequate information when they were here on a couple of the items. We'll also be requesting a penalty discussion because we want to pay penalty. And we'll see how that goes. 2 separate conferences, 2 separate times. We haven't, we don't have data.
And the second was just a comment that I was very happy with the quarterly report, or was it a quarterly or a monthly report that our public facilities director?
It was a quarterly report. The board had asked previously for quarterly reports. Our animal control officer likes to do a monthly report because that's her system.
Mm-hmm.
And when I was having a discussion about the quarterly report with the public facilities director, I said, "Would it be okay if I do it monthly?" I said, "Yes, it would." We'll not object to any information.
Looks like he's getting some stuff done.
Definitely.
Yeah, we're making good progress.
Right. I'm not sure if it might be worthwhile in some, once a quarter, maybe, if he's got any presentation or anything he wants to do to the board, just all the stuff he's working on.
Just to see him
Yeah.
touch base there.
Yeah.
I agree.
He's certainly
I'd
going
like
to
to see that.
He's certainly, I'll make note of that, but he's certainly going to attend your workshop with the Harbor Committee at the end of the month, because we're working to make a list of 8,000 things we want to discuss and get them direction and conversation.
Hey, I did have a question. Are you done, Steve?
Yes.
Is that it? I did have a question on how does one get chosen to be the person to file the pier? Is that done by the harbor committee? No. Possibly be a self-appointed thing.
I was gonna say, so who's making the decision?
Okay, that's all I needed to know. Just wondering. Okay. Thank you.
And for anybody that couldn't hear at home when I raised my hand, that's me.
Okay. All right, I had no idea how that process went. That's why I asked. Okay. All right, is there anything else? And before we adjourn, we need to go into executive session.
Yes.
So I will accept a motion.
I move that the select board enter executive session for purpose of discussing possible property tax abatements due to poverty and or disability pursuant to Title I MRSA Section 4056F, Title 36, Section 8412E.
Second.
Moved and seconded. Any discussion? No discussion. All those in favor? Thank you. We will move into executive session.
Thank you.
You're welcome. Have a good night.
Thank you, Melissa.
You too.